very complicated, but it is very timely question, because obviously almost everybody in this country, they heard about CBD and Epidiolex and medication that we have approved for epilepsy. I think the biggest problem, in my opinion, with CBD is the fact that there is so much excitement about it. You know, I just mentioned epilepsy surgery, the lack of excitement from the colleagues and lack of knowledge from the community about the potential positive implication of epilepsy surgery. Here it's the other way around. The excitement about CBD doesn't come from the epileptologist, epilepsy specialist, neurologist. Actually, it comes from society, from the community, from everybody you talk to. They would think CBD is the best thing or best treatment for not only epilepsy, but best treatment for many other things. So now, what is my opinion about CBD? I think if I want to be positive, I'm trying to be positive. If I want to be positive about it, I would say that, you know, CBD has a place to treat what it was approved for, Lennox-Gastaut and Dravet. And I'm happy that at least there has been a clinical trial that the FDA was able to supervise and to make an independent scientific judgment about the benefits for this. Now, beyond this, would there be any possibility or any use for CBD outside these two rare epilepsy diagnoses? I believe there would be, but we don't know. And it's not the first time that happened with any medication like we have, you know, where a medication is approved for a particular condition, and as clinicians, because there is a need, we feel there is a need for patients, we use it off-label to try it on another condition. Now, this is what we've been doing now. I'm an adult epileptologist. We've been doing on treating some of our patients who failed many other medications and who are pushing us to use this, which is uncomfortable, tell you the truth. It's like you feel like all of a sudden that the patient look at you and said, oh, you don't want to give me a medication that is good for me, which other way around. Actually, our job is to treat patients and to make sure everything is controlled with them. But what we see here is patients pushing us for this, and we're using them. We're using this medication when we think other options have not been good, or we don't have any more options. And in some other diagnoses, the results so far are very mixed, which is not surprising. Any new medication that comes, there is a small niche of patients, small group of patients who respond well, and then we try it in other diagnoses, other types of epilepsies, and we discover along the way that there may be some uses in some particular situation, 1 or 2 or 3 situations. So we are at the stage now where we're using it as judiciously as possible, as carefully as possible, trying to fend some of the pressures that comes on us from our patients, the family, society, even some of our colleagues, and try to understand where would be the usefulness of CBD outside Lennox-Gastaut and Dravet syndrome.